My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a glucagon-like peptide 1 receptor agonist, GLP-1RA, is a medication that has gained significant attention for its efficacy in managing weight loss, type 2 diabetes, and cardiovascular risk reduction? One notable feature of semaglutide is its lack of direct cardiotoxicity, which sets it apart from some other weight loss and diabetes medications that carry cardiovascular risks. Understanding why semaglutide lacks direct cardiotoxicity involves examining its mechanism of action, clinical data, and its effects on cardiovascular health. Mechanism of action and cardiovascular impact. Semaglutide mimics the action of the incretin hormone GLP-1, which regulates blood glucose levels and appetite through several pathways, enhancing insulin secretion. It promotes insulin release in a glucose-dependent manner, reducing the risk of hypoglycemia, a common cardiovascular stressor. Suppressing glucagon. By decreasing glucagon secretion, semaglutide lowers fasting and postprandial blood glucose levels, preventing the vascular damage associated with hyperglycemia. Slowing gastric emptying. This contributes to improved satiety and reduced calorie intake, which can lead to weight loss, a key factor in alleviating cardiovascular strain. Semaglutide's mechanism supports cardiovascular health by addressing metabolic factors like obesity, hyperglycemia, and insulin resistance, which are closely linked to cardiovascular disease, CVD. Unlike some older weight loss agents or diabetes drugs, e.g., thiazolidinediones or certain sulfonylureas, that have been associated with adverse cardiac events, semaglutide does not directly affect cardiac muscle cells, ion channels, or conduction pathways, thereby avoiding direct cardiotoxic effects. This pivotal trial assessed the cardiovascular outcomes of semaglutide in patients with type 2 diabetes at high cardiovascular risk. The study found that semaglutide significantly reduced the risk of major adverse cardiovascular events, MACE, including non-fatal myocardial infarction, non-fatal stroke, and cardiovascular death. Importantly, there was no evidence of direct harm to cardiac function or structure. STEP trials, weight loss programs. These trials evaluated semaglutide's efficacy for weight management in individuals without diabetes. The findings showed significant weight loss, which is independently associated with reduced cardiovascular risk. No increase in cardiac arrhythmias, heart failure, or ischemic events was observed, underscoring the drug's cardiovascular safety. Lack of direct cardiotoxicity. Semaglutide's lack of direct cardiotoxicity can be attributed to several factors. Absence of cardiac ion channel effects. Unlike drugs that prolong the QT interval or affect cardiac ion channels, semaglutide has no known effects on these pathways, minimizing the risk of arrhythmias or conduction abnormalities. No negative inotropy. Semaglutide does not impair myocardial contractility, ensuring that it does not exacerbate heart failure or reduce cardiac output. Weight loss and hemodynamic benefits. By promoting weight loss, semaglutide reduces blood pressure and systemic vascular resistance, which alleviates cardiac workload and improves overall cardiovascular health. Anti-inflammatory effects. GLP-1 receptor activation is associated with anti-inflammatory and antioxidative effects, which may protect against the development of atherosclerosis and other cardiovascular conditions. While semaglutide does not cause direct cardiotoxicity, it may lead to side effects such as mild increases in heart rate in some individuals. However, these changes are typically transient and clinically insignificant, especially in the context of its overall cardiovascular benefits. Furthermore, any potential indirect cardiovascular effects are outweighed by its ability to reduce risk factors such as obesity, hyperglycemia, and hypertension. Reduction in visceral fat. Excess visceral fat is a major contributor to CVD. Semaglutide-induced weight loss preferentially targets visceral fat, lowering the risk of metabolic syndrome and cardiovascular complications. Improved lipid profiles. Weight loss is associated with reductions in LDL cholesterol and triglycerides, as well as increases in HDL cholesterol, further reducing cardiovascular risk.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.